Welcome to the 7th annual Max Gray Fellows in Mood Disorders Salon. 7th, wow. For those of you who don't know me, I'm Laurie Gordon, founder of the Max Gray Fund for the Treatment of Mood Disorders and chair of the Resnick Neuropsychiatric Hospital Board of Advisors. Thank you all so very much for joining us today and for your continued support of the Max Gray Fund. This is one of my happiest days of the year. Since 2014, together, we have raised, wait for it, I'm going to start to cry, I can't even believe it, over $1.7 million. That is extraordinary. While we miss Maxie every day, his legacy lives on through the 21 fellowships and the hundreds of patients and their families who have received and continue to receive state-of-the-art care in our child and adolescent and adult mood disorder clinics. Wow, what a day. I'm so happy. Before I go any further, I would like to introduce you to Dr. John Mazziata, Vice Chancellor of Health Sciences at UCLA and the CEO of UCLA Health.
It's my privilege to be here, Laurie. $1,775,000 for this program since 2014 is indeed extraordinary and will help so many patients today and countless others well into the future. Your hard work and the generosity of so many have funded 21 fellows in pediatric and adult psychiatry. It is not only remarkable, it's incredibly important. The pandemic has highlighted mental health as a critical challenge. I'm happy to report that thanks to the Max Gray Fund, there is hope. Next year, there will be 4 Max Gray Fellows, 3 fellowships in child psychiatry and 1 in adult. Fellowships transform what we achieve as an institution, including our capacity to treat patients. The 3 current Max Gray Fellows helped increase the number of children seen in the first 6 months of 2021 by 57%, compared to 2018 when there was only 1 Max Gray Fellow. This is a very important program for UCLA. This is a very important program for children, adults, and families. I'm humbled by the hard work and generosity that have made this tribute to Max such a success. Thank you.
I feel honored this year because we are actually at the Max Gray Champ Clinic. This is where the magic happens. I have the privilege of introducing you to all of our fellows and giving you the latest news from Max Gray Champ. Unfortunately, this year we don't have an adult mood disorders fellow, but Dr. Gitlin assures me that next year we will. Next, I would like to introduce you to Dr. David Miklowitz, who leads the Max Gray Champ Clinic, who will give us a brief update in what's happening at Champ now. David?
First, thank you, Laurie. Real pleasure to be here.
Oh, it's my honor.
You know, this has been a very challenging year and a half for all of us, for the whole society in terms of the pandemic, social justice issues. Kids are under a lot of stress. And as you know, the Surgeon General has earmarked child mental health as one of the key areas for health in the next decade or 2 decades because of the increases in anxiety and depression, some of the things we've seen during the pandemic. One of the things I'm very pleased about is that the Champ Clinic has really been able to evolve and change with the needs of the pandemic. We've been able to, as you know, recruit our largest number of Max Gray Fellows. This past year, we have 3 new fellows. We increased the number of encounters we had with kids by 43%. And I think some of this is because we were able to adapt to telehealth. Telehealth, as you know, allows us to talk to families in their home environment, to be able to do an interview or a therapy session or an assessment session right there where they are instead of having them drive to UCLA and park and pay for gas and all the things that go into getting to an appointment, we can do much more easily. And as a result, we've been able to reach more people, particularly people of lower socioeconomic status who might otherwise have to miss work to get to a session. So telehealth, I think, has really been an advantage for us in terms of child mental health.
Do you think telehealth is really as effective as in-person therapy?
There is evidence that it is. That has been studied.
That's wonderful.
And I'm sure that we're going to find out there are some pros and cons to both. But from everything we've seen so far, psychotherapy seems to be just as effective by telehealth as in person, which surprised me. I didn't expect that.
That's terrific.
Now, the other thing we've done is we've developed a mental health app to go along with our family therapy. As you know, our specialty is family therapy for kids who have mood disorders and their families who are under a lot of stress. And with an app, they can consult various tips for coping, some of which you'll hear about today. They can track the kid's mood over time to know when they're going in and out of episodes. So in combination, this has been able to help us reach a larger number of kids over the course of the last year or two.
That's wonderful. May I ask you to say a few words about our 3 terrific Max Gray Fellows?
Yes, I'm very proud of our 3 Max Gray Fellows. We have first Megan Ichinose, who is a psychologist and has been with us now for 2 years. She's going into her 3rd year of Max Gray Fellowship. She's terrific. She was a psychology intern here and had been a doctoral student at Vanderbilt University before that. She's great with patients and families. She's also a very good researcher. So we're very happy to have her. We just began with Greg Barnett, who is a psychiatrist, a child psychiatrist, and one of the star graduates of our child psychiatry program. And he has an interest both in medication management and in psychotherapy, both individual and family psychotherapy. He's a really good therapist. We're happy to have him. Then we have Jen Gamara, who's a psychologist, a graduate of UCLA's clinical psychology program. She's very interested in child community mental health and has helped us open the doors to Spanish-speaking families, which we hadn't been able to do before. She's taught us a lot about working with different cultures, ethnic groups. So they're really a great group. I'm very proud of all of them.
Wow, that is terrific. Why don't you share the exciting news about the grant from the National Institute of Mental Health? We're very proud of this.
We're very excited about it. We've started a 7-site study. We're the organizing site. There are 6 other universities working with us. And the title of the study is UPLIFT, which is an acronym for Understanding Prodromes and Lessening Illness with Family Therapy. And what it is a study of family intervention for young adults and adolescents who have the early signs of psychosis. So kids who have some sort of low-level delusions or suspiciousness or unusual thought content or perceptual changes. Some of those kids, unfortunately, are at risk for schizophrenia. What we want to do with our treatment is try to delay the onset and change the trajectory, really, of these early symptoms for kids so they don't go on to develop a severe mental illness in adulthood.
Oh, that's terrific. That's wonderful.
And then we have a second grant that's being managed by Mark Weintraub, one of our psychologists. He has a K Award, as it's called, also from National Institute of Health. And his work is on group treatment. So we have group therapy also available, cognitive behavioral therapy, mindfulness treatment for adolescents who are in the early phases of either mood or psychotic disorders.
That's wonderful.
So I'm very pleased with where the program is going. I thank you and Steve Gordon for your incredible generosity in setting all this up. And of course, to the many people who've donated to our program. That's really made this us be able to rise to the challenge of the past 2 years.
I'm so grateful, David. To have you at the helm for the Max Gray Champ Clinic is terrific. And Michael on the adult, Gitlin on the adult side, we couldn't be happier.
Very pleased too. And of course, Dr. Gitlin and I collaborate all the time. We send patients back and forth, and we're
Yeah, he assures me that he has an adult fellow for next year. So
That's great.
terrific. Thanks, David. And now I'm delighted to moderate a conversation with our 2022 Max Gray Fellows that you've just heard about, Doctors Megan Ichinose, Jennifer Gamora, and Gregory Barnett. Megan, we're so happy that you're here with us again. Many of us remember you from last year's salon. I'm so happy to share that you got engaged this year. Megan, what's it like returning for a second year as a Max Gray Fellow? Are there any things you've noticed this year that seem different in regard to the challenges families have faced since last year?
Thanks so much, Lori. Well, it's a thrill to be back for another year. I've been really enjoying my second year as a fellow. And I think that, the changes that I've seen this second year around is now facing a different type of stress. And that's the stress for youth, at least in returning back to school full time. So with that, I think comes an adjustment, a transition. And for our youth who have challenges with anxiety, I think that transition has brought along kind of a new type of anxiety in terms of coping with the demands that their full-time school schedule has caused, and socially being with their peers full-time. So I've been working with youth and their families a lot and just coping with that transition. And then kind of practically speaking, as a second year fellow, something that's been really nice is just the continuity of care that's afforded. So I'm still able to see my patients that I started seeing in the first year, and speaking to that transition and how hard it's been in returning back to school full time, being able to provide that continuity of care for my patients has been really, really helpful. And then I think just kind of from a logistic perspective, at the Max Gray Champ Clinic, we've continued to offer telehealth services, which has been wonderful because we've been able to reach so many more families in the Southern California area. But we've also started seeing families in person as well. So it's nice now to offer the option for families who either, for convenience purposes, want to continue being seen in telehealth, or who think that it would be more helpful to have an in-person evaluation or in-person treatment. We offer that now too.
Oh, that's terrific. Now I'd like to welcome Dr. Jennifer Gamora. She's the first person in her family to get a doctoral level degree. Jennifer, tell us a little bit about yourself and why you became a psychologist.
Yes, definitely. Thank you so much for having me. I'm excited to be here and to share this with you all. My family is all in New York, and I was born and raised there, and we're really close, so I never thought I was going to leave New York. But then I eventually applied to colleges and got into the University of Pennsylvania, so I did leave New York for that. And at UPenn, I became really interested in psychology. So after I graduated, I moved to Boston and worked at the VA hospital, where I learned a lot about evidence-based treatments and what it takes to bring evidence-based treatments into the community. And I got really interested in community mental health.
That is terrific. And what brought you to UCLA from Boston?
So I came to UCLA to get my PhD with Dr. Bruce Torpeda, and I was really able to merge all of my research interests here. I was really interested in working with youth and figuring out how to make effective treatments for youth available in the community. So I did that, and then I was excited to continue here at UCLA in CHAMP, where I could learn more about how to help youth with more severe mental illness, and really continue to be involved in research and really round out my clinical skills with this new population, and actually been afforded the opportunities to engage in outreach with these different communities as well.
That is amazing, really terrific. Greg, why don't you tell us a little bit about yourself and what brought you to UCLA besides our beautiful sunny weather?
Sure, thank you. So I was born in Brooklyn, New York, and raised
Wait, we have 3 New Yorkers in here. Jen, you, and me. That's
right.
Pretty impressive.
Just collecting New Yorkers in Southern California. But I was raised in Raleigh, North Carolina, and fortunate enough to get into Yale University for my undergraduate degree. That's where I went and got my bachelor's in psychology. At Yale is also where I decided to pursue my medical degree to become the first physician in my family. and ended up at Brown University for my medical school training.
Way to go. Yeah.
Thank you. I was one of the few people that go to medical school thinking they want to be a psychiatrist, and so ended up down the road in Cambridge, Massachusetts for my adult psychiatry residency training at a Harvard Medical School affiliated hospital. And it was there where I decided to pursue child psychiatry. And after 13 years in the cold, cloudy weather in New England, I decided to head to Southern California for my child psychiatry training at the UCLA Semel Institute. And I graduated from there summer of 2021. And while I was doing my training, I learned about the complexities of childhood mood disorders and how important it is to treat the families as well. And it was through that I decided to continue my training as a Max Gray Fellow to learn more about the pharmacological treatments, as well as to be able to pursue more individual training supervision, just because as a psychiatrist, that doesn't tend to be a big part of our training. And I think it's important to be able to provide that to the families that I treat.
That's terrific. So you do both talk therapy and medication.
I do, and I love doing both. It's a passion of mine.
That's terrific. Well, we are so lucky to have you remarkable fellows. I'm going to ask you to share some of your insights with our supporters. What happens when a family in crisis calls? Can you walk us through the procedure? Megan, let's start with you.
Yeah, of course. So first, a family, usually a parent, is calling, is connected with our clinic coordinator, who will share with them the range of services that we offer at the Max Gray Champ Clinic.
And this clinic coordinator is kind and welcoming and has lots of information.
Definitely. She's wonderful at her job and puts families at ease, I think, which is important.
That's who we want for the first point of contact.
Definitely. And so she'll work with the family to decide kind of what's the best fit in terms of services that they need. So one thing that's unique that we offer are these comprehensive evaluations, diagnostic evaluations, and those are for more complex cases. So children or teens where their current providers might not be clear on
These
their...
are a few appointments over a few weeks.
Exactly. Yeah. A few appointments over a few weeks. And again, these cases are where their current providers might not be clear on their diagnosis or kind of optimal treatment. So they see us for 2 sessions. They'll work with a Max Gray Fellow and then also with one of our psychiatry fellows for at least 1 appointment for a medication evaluation. And then together, it's really nice because we can work as a team to decide diagnosis and then treatment plan. And sometimes that involves staying in our clinic for treatment, and sometimes that means referring out to a specialized clinic that's more fitting for their diagnosis. And then outside of the evaluations, we also offer treatment. So we have our family therapy clinic on Mondays.
Which you love.
Which I love. Yeah, that's one of the main selling points of staying in this fellowship is really the family therapy opportunities. And it's actually very rare to find family therapy in the community as well. So it's really nice that we're able to offer that and cover it with insurance. And then additionally, we have ongoing medication management through that clinic if you're being seen for family therapy as well. And then outside of the family therapy and medication management, we also have a couple of research studies going on that provide treatment free of charge. So one of those studies are for youth who are at risk for developing a psychotic disorder. And we find that in those populations, the earlier you intervene, the better. So we offer family therapy services for youth and their families who are at risk. And that is actually across the course of 6 months. So they get quite a bit of treatment.
And free of charge.
And free of charge.
Because it's a research study. That's
exactly,
fantastic.
yeah. And then the other study that we have going on are ongoing skills groups for teens who have a range of challenges with mood or anxiety or behavior. And during those groups, teens get to learn coping skills that are either based in mindfulness or cognitive behavioral therapy. So it's a very active and skills-based group where, ideally they're learning a lot about how to manage their own symptoms.
That is terrific. That's wonderful that we offer those resources. And I'd just like to add that I know that before we had any Max Gray Fellows, the waiting time to be evaluated was a matter of months. And now, because we have 3 Max Gray Fellows in the Child and Adolescent Mood Disorder Clinic, the waiting time is to be evaluated is now down to a number of weeks. So. Wow. Thank you to all of you out there who support us It's really enabling us to make a difference, so thank you. Hope in the face of uncertainty is so important, and there is still so much unknown ahead. The rules change every day. Jan, are there any coping mechanisms or tools that you would recommend to children, adolescents, adults, and families to help deal with this uncertainty?
Yeah, I definitely like recommending mindfulness and doing mindfulness meditations. So when I say mindfulness, we think about staying in the present moment, focused, and without judgment. And there are a lot of really wonderful mindfulness meditation exercises that families can do. And we actually do have a mindfulness resource center here. It's the UCLA Mindful Awareness Research Center, also known as UCLA MARC. And they have a number of really great guided meditation exercises that families can use just as a way to take a step back and de-stress and become present in the moment.
Oh, that's terrific. That's great insight. Mm-hmm. During this past year, we've all had to adapt in many ways. Greg, what changes have emerged in your short time as a fellow that you will continue to use in your private practice?
Yeah, I think it's the use of multimedia, especially given how much time we spend in front of our computers and devices. Physicians, providers, families have gotten used to telemedicine and the different platforms that we use, and this has really increased ease of access. It's removed some of the burden for some of the families that we see.
Do you feel it's as effective, telemedicine, as practicing in person?
I think in many ways it is.
That's great.
Yeah, I think it's definitely allowed us to expand how we're helping people, and we're still very effective with it.
I love the access, that it opens access to people so they don't have to drive and park and families can stay together.
Right.
But if you think it's as effective, that's important.
Yeah, it's definitely forced us to learn how to be more creative with how we're providing care. And you know how difficult it is to get to the west side from certain parts of the city. And
anywhere.
From anywhere, right. So lots of families are saving on things like gas, parking, time, and they're able to do their appointments from their homes where we're able to still...
And so there are less people that miss their appointments because
Exactly.
they know they have a telemedicine appointment.
Right.
Oh, so they're not stuck in traffic an extra half an hour.
Made a huge difference.
Oh, that's great. Jen, are there changes that have inspired you?
Yes, definitely. I think through the pandemic, we've really seen how useful technology can be in mental health treatment. So like Dr. Miklowitz mentioned earlier, we have an app that several of our treatment studies use that provides families the opportunity to check in and to practice skills that they learn in therapy. So it's another way that we can support them and get them to be engaged in the treatment.
That's terrific. And do the families really use this as a tool in their toolbox?
They do. Yeah, and it's been a really nice way to support them and to hear about what they're up to and to track their progress.
What are some of the things that you're doing to engage the Spanish-speaking community?
We're doing a couple of things that we're really excited about. The first one being we are actually translating the materials that we have that we give to families, so handouts for different treatments and flyers that we use for our studies. And then we're also currently working to outreach to other community mental health agencies that serve the Latinx communities in LA to let them know about the free services that we offer in these for specialized care.
That's terrific. And Megan, what changes have you seen that give you hope going forward?
Well, I think a big silver lining through all of this is the shift in attitudes towards mental health and seeking mental health treatment. I think just because it's really, the pandemic has impacted people and their mental health in such a great degree, people are much more open about sharing their own experiences with whether it be depression or anxiety or, whatnot. And because of that, I think people are, more open to talking about treatment and more motivated to get help. So that's definitely something that's really hopeful for me going forward.
That is terrific. How do you get kids and teens to change their behavior? What are your methods? Greg, do you have any thoughts?
Yeah, so getting teens and kids to change their behavior is extremely difficult.
Of course.
And honestly, one of the best things you can do is praise them. Not only praise them, but praise yourself whenever something goes well. Uh, the day can be full of just opportunities to highlight that something's been done that makes a parent happy. And by praising the child, by creating that opportunity for them to see that you've noticed something positive, it then reinforces the behavior.
Can you give me an example of that?
Sure. So an example could be if an adolescent or a teenager takes their dishes to the sink after dinner, and the parent can. And the key thing is to be very specific and sincere with what you say. So you could say something on the lines of, "Thank you so much for taking your dishes to the sink after dinner. It saved me some time afterwards to do other things." Or if it's a younger child, you could tell them that you're proud that they spent 30 minutes playing quietly with their younger sibling. And the specifics are are the keys, because that's what's going to tell the child or the teenager the behavior that you want to continue to see moving forward, even if you're not explicit about it.
That's terrific. That's great. Greg, switching gears again, in your profession, your main focus is helping others. That work can be really stressful. While you provide treatment to others during this unprecedented time, what coping mechanisms do you use for yourself?
Yeah, the biggest thing is just stepping away from my computer. As I mentioned before, we're spending a lot of time in front of devices these days. And so I make sure to either schedule or have something set up where I'm stepping away, whether it's to go to the gym, whether it's to go for a walk around my neighborhood briefly. And I recommend the same to my patients and families. Be something as simple as drinking your favorite cup of tea. You could encourage kids to do safe activities, going outside riding their bikes, playing with the dog, coordinating something with friends, whatever you feel comfortable with. But it can get very easy to get sucked into just meeting after meeting or Zoom after Zoom.
It's exhausting for
And it's
sure.
definitely exhausting. So to be intentional about having something scheduled to look forward to out of your day is helpful.
Oh, that's good. Jen, what coping mechanisms do you use?
I like to see mental health as just another part of physical health. So that means taking the time to rest. And if you're feeling run down emotionally, or you feel like you've had a really taxing day emotionally, treat it as if you've had just a really exhausting day physically. Get rest, take some space, move around the same way you would if you were, battling a cold. Treat yourself with that much compassion and with that much care. And I think especially for the children and families that we see, there isn't a lot of movement and activity, especially because of the pandemic and being stuck inside and at home. So like Greg mentioned, making sure that they can move around and get some physical activity going and see those natural boosts in mood that being physically active can do. So I think that's a really helpful way to think about it.
Oh, that's great. Is there a tool that we can all use to help us get through this challenging time? Greg, why don't you take this one?
Yeah, so one thing I talk to a lot of families about is starting low and going slow. And what I mean by that is that as the world opens up and as you're going back into the social world, taking your time, exposing yourself to social situations, because whether it's your kids going back to school or yourself going back into doing social activities, it would be natural to feel anxious about these things. So you want to gradually increase how much you're exposing yourself by, say, going to the park for 10 minutes until you're comfortable, and then increasing that to 20 minutes, then maybe 30 minutes. You can do the same thing with your kids. You could have them call up a friend and set up a very relaxing interaction, and then gradually increase the exposure over time.
Oh, that's a great idea. Very helpful. Is there another idea that you have?
Yeah, there's this thing called a gratitude jar. And what this jar...
A physical jar.
It's a physical jar that you can create. You can use your creative juices. You can do it as a family or individually. And what you want to do is at the end of the day, on a piece of paper, take some time to write down some positive things that have happened to you during that day. You gather your thoughts, you write them on these papers, and you put the papers into the jar that you've created. And when you're feeling down or when you're being swept away by focusing more on the negative thoughts that are occurring, you can reflect on that jar. You can go and pull out a piece of paper and see that, something good did happen that maybe I forgot about.
Oh, that's great. And you could do the same thing in a journal as well.
Yeah, so for people that don't necessarily want to take the effort to make the jar, or the jar is not really their thing, you could also write it in a journal and, again, reflect upon it later on if things are difficult at the end of the day.
Oh, that's great. Jen, do you have any other thoughts?
Yeah, I like this idea of picking like a mantra or like a phrase that is really relaxing and calming to you, and just trying to keep that in your back pocket so that when you're feeling stressed out, you can really think to yourself, okay, what is the thing that I can tell myself to feel better? And it works, right? That's why you keep it in your back pocket. So something like, I have the time, or this will all get done when you're feeling really overwhelmed or stressed. This helps you keep yourself balanced and in a more wise mind, and can be something that you don't even have to think twice about once it's a habit.
Can you give me an example of one of those phrases that works for you?
Yeah, I really use this one all the time, which is, at some point it will all get done, right? Because there's so much that, we're juggling in our schedules. And I think it's really easy to become overwhelmed and think about, well, how's it going to get done? And just by virtue of reflecting on my life, every time I've had that moment, it's all gotten done at some point. So I've just told myself, it will get done some way, somehow. And that is always refreshing to remind myself of.
Oh, that's good. That's helpful. What about you, Megan?
These are great tips for, I think, personal self-care and maintaining that sense of sanity during difficult times. I think also higher stress levels can lead to interpersonal difficulties, can lead to more conflict. And we certainly see that with the families we work with. And so I think for me, part of helping with that conflict is being a really good communicator. And so my tip is actually to be an expert, active listener. When we think about communication in family therapy, a big portion of it is listening, not just sharing. And so there are some tips that I have for active listening, and we actually teach this skill to families too in the clinic.
Oh, that's great.
Yeah. So with active listening, you want to, of course, listen, but you want to show those good nonverbal and verbal cues that you're listening. So you might nod along, make good eye contact, not look down at your phone, right, while someone's talking to you. And then those verbal cues include asking clarifying questions, so making sure that you fully understand what the person is saying. And then crucially, at the end, after they're done talking, you want to paraphrase back what they've said or check out what you've heard to make sure you really understand it and there aren't any misperceptions or misunderstandings.
That's a really good tip, active listening. We should all be doing that. These ideas are all terrific. On a slightly different subject, how do you deal with long days on Zoom and telehealth? I know Zoom has been really exhausting for me. Greg, can you take this one?
Yeah, so the gym is one of my safe havens, so I make sure I'm having my physical activity. I schedule my breaks, go for walks, and I also maintain communication with my family, my friends, my support system, so that when things are feeling more difficult, I have places I can lean, and other folks have ideas that can also help me kind of get through the more difficult days that come up from time to time.
We've heard such wonderful ideas from all of you. Can you each share one strategy to emerge from this uncertain time even stronger than before? Jen, let's start with you.
Yeah, it's definitely been a whirlwind of a time, and I think for everyone, for ourselves, but also the children and families that we work with, I think reminding ourselves that things are going to take time. We're having a lot of transitions again, and expecting things to go back to normal right away is going to be tricky. So I think taking baby steps, taking it slow, and really trying to think about, what are the small achievements that we make each day as we, re-enter a new world.
And what about, you shared with me before this strategy about a family calendar. Would you tell us about that?
Yeah. So one of the things that can be really helpful for families and for ourselves is to write out the things that you have to look forward to and the things that are important. And even if it's, a week ahead or a month ahead, just having things in your schedule that you can look forward to and that will boost your mood. So sometimes it's not always the fun things that boost your mood, like watching a movie. Sometimes it's doing these achievement activities like cleaning your room. So that could be something that helps families bond and, get those natural boosts in mood.
And having the physical document.
Yes. Yes. So that could, that adds the extra layer of accountability.
Oh, that's terrific. Megan, what's your tip for emerging more resilient?
Well, I think now is a really excellent time to start to notice what emotions you're having when feeling stressed. See if you can be specific and label your emotion, because I think labeling your emotion, naming the experience, is the first step towards feeling a little bit more in control and knowing what you can do to cope. So we call that being an emotion detective in a way.
Oh, that's great.
Yeah. And you can encourage, your kids to do that too if you have children. Get them to label what emotions they're having, they're feeling.
Or your spouse.
Exactly, or your spouse or partner, right? It's helpful to be able to identify that emotion because I think it creates this common vocabulary for people, and then kind of how best to support them in that moment, or can start problem solving from there after identifying that emotion.
And sometimes I've heard people categorize their emotions like a traffic light. Could you explain that to me?
Yeah, and this works great for kids too, but being able to, like you said, categorize emotions in terms of colors, like maybe you're thinking about red light, green light.
Yeah.
Same thing with like an emotion thermometer, where green emotions might be you're feeling more calm or happy or energized or relaxed, whereas those hotter temperature emotions or red light emotions or red zone emotions might be angry, frustrated, overwhelmed, panicky, or fearful, right? So again, that can go towards a quick check-in and a common vocabulary among family members for when they're checking in with each other about how they're doing.
Oh, that's great. So if your kid has a hard day at school, he or she had a difficult situation, they could say, Mom or Dad, I'm in the red zone right now.
Exactly.
Give me a little space till I can work it out.
Exactly.
Oh, that's great. Greg, what's your tip for resiliency?
Yeah, so staying connected and creative is going to be super important. As we emerge from the pandemic, we've noticed that social isolation has been a huge part of what people have been dealing with and has really caused havoc on individuals' mental health. And so I would recommend that families sit down together and discuss the ways in which they've found to stay connected with others in both traditional and novel ways, because this can lead to feeling productive, can also carry over into the future as we look back and see that we've come out of this stronger than we were before.
That's great. Now I'll turn back to Megan for my favorite part of the evening, when you all get to hear from a former Max Gray Champ clinic patient, Jasmine.
Thanks, Lori. So Jasmine is a 16-year-old teen who participated in one of our mindfulness skills groups this past fall. And she presented to the group with challenges with mood, a lot of depression and anxiety, and was having a really hard time going to school, feeling like she could stay on top of her assignments, and feeling less motivated to hang out with her friends. And she was someone who really took to the mindfulness skills, and which is what we love to see as group leaders. And so much so that I think not only her mood improved, but her outlook on treatment improved. And she is now enrolled in another one of our skills groups for this spring. Yeah. So I'm really excited that she's here to talk a little bit about her experience in the group.
That's great. Now we'll hear from Jasmine. Thank you.
Hi, my name is Jasmine, and I'm a 17-year-old senior in high school. I participated in the mindfulness group. I was interested in this program because I was not in a good mental state and needed help at the time. One-on-one therapy wasn't really working for me, so I wanted to give group therapy a try. Also, the topic of mindfulness really intrigued me. Before I received help from the CHAMP program, I was really depressed, anxious, irritable, and I had really bad mood swings. I wasn't even motivated to do the things that I normally enjoy doing, like playing volleyball and hanging out with friends. I definitely found the mindfulness meditations the most helpful to me. The meditations were always able to relax me and reduce my anxiety. I still meditate every night before I go to bed. My life now is a lot more enjoyable because I feel happier. Also, when I had bad depression and anxiety, it affected my performance in school and I felt less smart and more slow. Now that my mental health is better, I have been performing better in school and I feel a lot smarter. I'm definitely able to handle challenges with my mood, stress, and anxiety after participating in this mindfulness program. I feel a lot more calm and in control of my emotions. I'm so grateful to have participated in this program.
Thank you, Jasmine. I'm so happy you were brave enough to share your story. We all wish you continued success and good luck as you continue your journey. I am so very proud of the work that we've done this year. Thanks to all of you supporters for your extraordinary generosity. And to our terrific Max Gray Fellows, thank you for sharing your stories and your dedication to this very important work. You really are making a difference, and we are all so grateful. Thank you also to Drs. Gitlin and Miklowitz for their leadership, who have made this evening and 7 years of helping people possible. We're very grateful. Thank you. Now I'm thrilled to share with you that Dr. Arthur Gillis, a former Max Gray Fellow, whom you might remember, is now not only a full-time UCLA faculty member, go Bruins, and physician, but also about to be approved as the inaugural holder of the Resnick Neuropsychiatric Hospital Board of Advisors Term Chair in Psychiatry. Dr. Gillis, we are so proud of you. Where are you working in the hospital now? And could you please say a few words about your journey and your hopes for the future?
Absolutely. But first, Lori, I just want to tell you thank you. I cannot tell you how much I appreciate the opportunity to engage in post-fellowship training in childhood mood disorders. Taking the time to invest 2 years of postgraduate training in childhood mood disorders greatly increased my confidence in my clinical skills. Just this past summer, I started working as an attending psychiatrist.
Wow.
Yeah, on the child inpatient unit at Resnick, and I cannot tell you how much I utilized the knowledge and skills I gained as a Max Gray Fellow, not only to treat patients, but also to educate our young psychiatrists in training. My clinical and research focus as a faculty member is on early life adversity and preventing the onset of psychiatric disorders, problematic substance abuse, academic failure, and juvenile justice involvement.
What specifically from your training as a Max Gray Fellow have you used in practical application in the hospital?
Well, just last week, when I was in treatment rounds, we referred an adolescent patient to the Max Gray CHAMP clinic. Because of my training as a Max Gray Fellow, I was able to describe in detail exactly what type of training the family will access, including family-focused therapy, so that the fellow treating the patient would be able to provide guidance to the family.
That is amazing. That's wonderful. I couldn't be more proud. What are your hopes as the incoming term chair recipient?
My hope as the term chair in health equity and hospital psychiatry is to expand our reach in Los Angeles County to improve families' access to high-quality psychiatric care.
That's amazing. Our mission as a public university at UCLA is to increase access to the public. So we're so proud of you, Arthur. I know Max would have been proud of you, and he would have loved you. Wow, Arthur, we couldn't be more impressed. We're so grateful for your service and our friendship, and thank you. I can't wait to watch what's going to happen in the next 5 years. Thank you so much. In closing, I'd like to call on Jonice Spiso, President of UCLA Health, CEO of UCLA Hospital System, and Associate Vice Chancellor of Health Sciences, who has done such a remarkable job keeping UCLA Health running so efficiently despite the pandemic challenges of the last 2 years.
The CHAMP program is incredibly important to our child psychiatry work at UCLA Health and our Resnick Neuropsychiatric Hospital. The stress of the pandemic, particularly on our youth, adolescents, and young adults, has exacerbated the mental health crisis, straining capacity for care. Thanks to the Max Gray Fellows, our capacity for psychiatric care has increased. These fellowships are the perfect complement to our plans for expanded mental health care, including our future Mid-Wilshire campus, which will be dedicated to mental health. The inpatient hospital will have a dedicated psychiatric emergency room, including one for pediatric psychiatric emergencies. These combined efforts will transform UCLA Health's ability to improve access to care and to provide and better meet the needs of our community. I cannot thank Lori Gordon, Chair of our Resnick Neuropsychiatric Hospital Board, enough for her tireless dedication to improving access and care for behavioral health. She has inspired so many generous donors to support this work and expand psychiatrists in training to help UCLA Health continue to serve our community. Thank you.
Thank you, Jonice. I'd also like to say a big thank you to my husband, Stephen, and my son, Charlie, for their love and support. For anyone who would like more information and resources, we have shared the Max Gray Fund website in the chat at the bottom of your Zoom screen. Also, everyone who registered for this event will receive a follow-up email with some takeaway tips for you to use at home and a link to this event. I can't thank you all enough for joining us and for your continued support of the Max Gray Fund since 2014. Please stay safe and be well. And let's hope that next year we can be together in person. Thank you.